Alright guys, so a little change of scenery. Figured I'd join Simba, Mr. Grandpa, on the floor, because, what else are we gonna do today? Last night was really bad. All of a sudden around like 8 p.m., I got this like really sharp pain in my like hip, like that sciatic nerve pain. Wasn't sure what to do because it was almost like it was bouncing back and forth between my lower leg and my upper leg. And that's one of the nerves that we targeted. But so I was like, is it the device that's causing this? Or is it like, did I sleep wrong or what? I didn't know. And so I called the rep. And I told her, I tried turning the device up, I tried turning the device down, I tried turning the device off. And so she said, well, just try turning it off for like an hour. Well, I turned it off, fell asleep for a few hours, woke up, felt so much better. So then I was like, is this device making things worse than better? Because, quality of life right now is pretty crappy. At least before having this procedure, I could use a stationary bike and, wheel around and on the wheelchair. But right now I'm pretty much couch bound, and it's very frustrating because, it's just like this never ending cycle of surgery and weakness and then recovery. And as anyone knows, even just like a few days on the couch, it like really zaps you of your strength. And so, really struggling with that today. I just want to do what I was doing before this. And I know that I need to be patient, and, in a week I could feel wonderful and be doing different stuff. But I'm going to really have to have a chat with my surgeon when we talk on Tuesday. That's when I go in and he'll look at the site and see how everything looks, and I'll be able to sort of see what he thinks. Anyone in the chronic pain community knows that a lot of these doctors, they get kickbacks. And so I personally don't feel like you can ever 100% trust the real purpose behind any of these devices. Because for all you know, the only reason they're doing this is to cushion their wallet. Because something I forgot to share yesterday is I was talking to the rep, and she was telling me that on average you get relief for a couple months to maybe a few years. The longest she's known is 5 years. So I'm like, well, I'm in my 20s, so unless I'm going to die in like 5 years, or, whatever the lifespan of this thing is after it's removed, if it even works after it's removed, I said, what do I do after? I'm like, well, what do I do after the pain goes back? And she just didn't have an answer. So I'm like, oh, that's great. I'm like, so we're putting a Band-Aid over a gaping wound, like we're putting this little short-term fix over a long-term problem. Like CRPS isn't going anywhere. It has no plans on taking a vacation. And so, in addition to talking to the pain management doctor, I'm also gonna talk to my neurosurgeon, who put in the spinal cord stimulator, because he's done an awesome job, and I have complete faith in him. Unlike the pain management doctor, I still sort of struggle because, I know I explained that, the procedure was really painful for me, and to have the doctor almost brag that he's had patients scream that loud during the procedure. I'm like, well, that means you're not managing their pain during the procedure well enough. And so it's like, you know, do you have my best interest at heart once again? So, yeah, I'm just sort of waiting things out. Today, took a little sponge bath and checked on my scars, and I am happy to say that one of them, the nerve pain, is completely gone. And the other one, I'd say a third of it, it's like probably 2/3 as sensitive as before. My heel still hurts a lot, and that's the huge issue is, you know, I can't walk unless I can, you know, put weight through my heel. And so, yeah, just a struggle to try to fill the hours because, you know, I was an athlete before all this craziness happened, and to really have most of your independence taken away for such a long period of time, like, it's rough, you know? It's like it's weird because, you know, even a grocery store trip had become like going to Disney World for me. But with COVID, I'm literally just in the house, and it's not like we can just invite random people over because, you know, I can't get exposed. So, for the meantime, it's just me and Grandpa over here, who is very tired from sleeping all night. And so, yeah. So, oh, hello, Nella. I guess that about sums things up for right now. Hoping to have a decent day today. Hopefully not sleep as much. Excuse me, ma'am. Hopefully not sleep as much. And, yeah, just take the day as it comes. Alright, hope you're doing well. Not getting licked by dogs. And, I will catch you tomorrow.